Namaskar dosto. Good evening. I'm Purnima from Fertility Dost. Welcome to yet another wonderful, interesting, and what we can say that session with a very experienced doctor. That would be the right way to say. So today we have with us very senior doctor, very experienced doctor. So we decided to choose a very wide topic related to multiple failures, multiple conception failures and solutions. आज सैटरडे के दिन हम चाहते हैं कि आप एज अ कपल इस सेशन को अटेंड कीजिए। कुछ चीज़ें, कुछ बातें जो आपके दिमाग में है, जो आप सोच रहे हैं, एंड इफ यू आर प्लानिंग न्यू साइकिल देन ऑल्सो यू आर वरीड अबाउट द previous failure, and if this is your first IVF cycle or you are planning natural conception, natural pregnancy, then also कहीं ना कहीं हमारे मन में एक डर, एक फियर रहता है। So today we have very senior doctor, Dr. Ishita from Varanasi, and with her we are going to discuss about this multiple miscarriages solutions. So please stay tuned. Just start pouring your queries, and let's begin the session. And we are so sorry for starting this session late. We are late by almost 30 minutes, but believe me, network है आजकल कहीं ना कुछ होता रहता है. Technical issues are there, glitches are there, but we are here to start the session. It will be a short session, but हाँ, आपके जितने questions हैं मैं कोशिश करूंगी कि मैं जितनी जल्दी हो सके डॉक्टर से उसके solutions, उन सवालों के जवाब आपके पास लाऊं. And once again, thank you UNS for arranging this wonderful session. हमारी पूरी जितनी ऑडियंस है दे आर रियली ग्रेटफुल, क्योंकि इन छोटे सेशन से उनको बहुत नॉलेज मिलती है, क्योंकि बहुत सवाल ऐसे हैं जो डॉक्टर से पूछने में रह जाते हैं. सो दीज सेशंस आर रियली हेल्पफुल. थैंक यू यूएनएस एंड थैंक यू डॉक्टर इशिता. लेट मी कॉल हर टू द मेन स्क्रीन एंड लेट्स स्टार्ट विद द सेशन. गुड इवनिंग. नमस्कार मैम.
नमस्कार, थैंक यू।
सो व्यूअर्स, आज हमारे साथ हैं डॉक्टर अवस्थी, डॉक्टर इशिता अवस्थी. शी इज द डायरेक्टर ऑफ उपहार नर्सिंग होम वाराणसी. शी हैज मोर देन 20 years ऑफ एक्सपीरियंस. जी हाँ, तभी हमने बोला आपके सवालों के लिए आज हम बहुत सीनियर डॉक्टर लाए हैं. शी प्रेजेंटेड मेनी पेपर्स ऑन मेनी टॉपिक्स. हर एरिया ऑफ एक्सपर्टाइज रिकरेंट प्रेगनेंसी लॉस, हाई रिस्क प्रेगनेंसी एंड यूटेरस कंजर्विंग. So, viewers, let's start with the main topic: multiple miscarriages and solutions. So, over to you, Dr. Rishita. सबसे पहले क्या रीजन हो सकते हैं? यूजली एक मिसकैरेज के बाद हमारे मन में एक फियर, एक डर बैठ जाता है. What if the next pregnancy also leads to miscarriage? So, what could be the main reason for this?
सबसे पहले तो एक बहुत बड़ा रीजन होता है स्ट्रेस. आजकल अपनी जिंदगी में इतना ज्यादा स्ट्रेस है, एनवायरमेंटल स्ट्रेस है, पोल्यूशन है. तो जो भी कपल आता है सबसे पहले हमको उसको ये अश्योर करना है कि ठीक है, एक खराब हो गया, वो अच्छी बात नहीं थी, लेकिन जरूरी नहीं कि अगला भी खराब हो. बिकॉज स्टैटिस्टिकली स्पीकिंग हम लोग की एक प्रेगनेंसी खराब होती है तो देयर इज 90% चांस कि नेक्स्ट प्रेगनेंसी एकदम नॉर्मल हो. एकदम नॉर्मल. और अगर दो खराब होती है तो देयर इज 70% चांस कि आपकी अगली प्रेगनेंसी एकदम आराम से बीती. और अगर तीन खराब होते हैं स्टिल देयर इज 50% चांस. So why are we seeing the glass is half empty? We have to see the glass half full. तो उससे एक लेवल का स्ट्रेस खत्म हो जाता है. और दूसरी चीज कि जब हम लोग we always request all the patients to come with their old papers, क्योंकि वो लोग क्या करते हैं, they are so upset with the whole thing कि वो लोग जो है ना वो पेपर्स उठा के फेंक देते हैं. They don't want to do anything to it. They want to, nobody wants to keep a bad memory actually. तो वो पुरानी खराब याद नहीं रखना चाहते तो उसको फेंक देते हैं. बट मेरी एक सिंसियर एडवाइस किसी भी कपल से है कि इवन एक दवा की पर्ची जो पुरानी है, दवा का बिल है, हाँ, तो उससे भी जो है आपका चीजें बहुत क्लू मिल जाता है. क्योंकि हम जितने ज्यादा भी इन्वेस्टिगेशंस करें, वी कैन ओनली फाइंड आउट फ्यू इन्वेस्टिगेशंस, फ्यू कॉजेज ऑफ इनफर्टिलिटी. क्योंकि 70% causes are unknown,
बिल्कुल,
है ना?
बिल्कुल। राइट, राइट, राइट। एंड डॉक्टर इशिता, यू राइटली सेड कि हम यूजुअली पुरानी रिपोर्ट्स, पुरानी दवा की पर्चियाँ, प्रिस्क्रिप्शन एंड ऑल दैट, हमको लगता है कि इतना सब कुछ क्या सँभाल के करना है, बिकॉज़ वो साइकिल तो हमारा सक्सेसफुल नहीं था। हमें पॉजिटिव
हम्म,
रिजल्ट्स नहीं मिले तो व्हाई टू स्टोर दोज़ अननेसेसरी पेपर्स विद अस? दिस इज़ अ फैक्ट। सो आई थिंक दिस इज़ वेरी इम्पोर्टेंट पॉइंट। व्यूअर्स, अगर आपके पास पुराने रिपोर्ट्स हैं, ऐसा मत सोचिए कि अब बेकार हो चुके, 2 महीने, 6 महीने, साल हो गया, देन ऑल्सो प्लीज़ टेक केयर ऑफ दोज़ पेपर्स। हो सकता है कुछ ऐसा आपकी उन रिपोर्ट्स में हो जो कुछ डॉक्टर्स को पिन पॉइंट कर सके कि येस, द प्रॉब्लम कुड बी हियर। डॉक्टर इशिता, मैंने आपके प्रोफाइल में आई जस्ट रेड वन थिंग, यूटेरस कंजर्विंग, सो आई रियली वांट टू नो मोर अबाउट दिस।
एक्चुअली इट इज नॉट रिलेटेड टू टॉपिक वी आर सेइंग, बट नॉर्मली
ओके।
क्या होता है कि जो है व्हेन अ लेडी गोज टू अ डॉक्टर एंड शी इज हैविंग सम प्रॉब्लम और द अदर, तो उसका मोस्टली उसके फैमिली मेंबर्स क्या होता है, डॉक्टर साहब बहुत झंझट हो रही, बच्चेदानी निकाल दो। हाँ,
हुँ।
सिंपल प्रोपियन है, सिंपल इन्फेक्शन है, या सिंपल डीयूबी है, तो या अगर कोई ले भी गया है डॉक्टर के पास, सब जगह घुमा फिरा है, तो भी वो कहते थे डॉक्टर साहब अब छुट्टी कर दो, अब बच्चेदानी निकाल दो। तो इट इज वेरी डिफिकल्ट टू, किसी खराब चीज को ठीक करना मुश्किल है ना? लेकिन अगर
राइट।
किसी चीज को जो है ना वापस से नया खरीद करना आसान है, सो यूजुअली व्हाट पीपल डू, इवन द लेडीज फेड अप, एंड व्हाट शी डज इज दैट शी सेज नहीं, अब मेरा निकाल दीजिए। फॉर एग्जांपल, सिंपल थिंग, एंडोमेट्रियोटिक पेन, उसकी फैमिली कंप्लीट हो गई है, शी इज 35, एडिनोमाइसिस है, हाँ, द यूट्रस इज अराउंड 8 वीक साइज, आप उसको एलएनजी आईयूटी लगा के कंसर्व कर सकते हो। You can
राइट,
give
राइट।
her a quality of life with that simple LNG IUD. People don't do that. वो भी तब तक फेड अप हो चुके होते हैं पेन से, क्योंकि हर जगह जाएगा बल्कि यूट्रस लिख के abdominal अल्ट्रासाउंड में छोड़ दो, and she lands up in hysterectomy. 90% of the time जो भी hysterectomy होती है, that is actually for benign causes which can be prevented.
Understood. Right, right. So, Dr. Rishita, what could be the main reason for multiple miscarriages? We know that we need to look upon the gamete part, we need to look upon the uterus part. So, what could be the
See,
main reason?
एक तो ब्रॉडली ये होता है कि एक तो देयर आर जेनेटिक कॉजेज, देन देयर आर स्ट्रक्चरल कॉजेज, जैसे सेप्टम है, कुछ है जेनेटिक कॉजेज, जैसे बच्चा में कोई जेनेटिक डिफेक्ट है एंड वो जीन वो जो है अबॉर्ट कर जाता है, और एक
Hmm.
बहुत बड़ा कॉरेक्ट विच इज 100% प्रिवेंटेबल, दैट इज अपला सिंड्रोम,
Right.
anti-phospholipid antibody syndrome. So when a patient comes with this syndrome and she has the old papers, and or if she is very educated, she is very well versed, so you can ask her or you can look into the old papers before abortions, was cardiac activity present or not.
Right.
If by
Understood.
chance, if the cardiac activity was present, then it goes towards aplastic. Many times it so happens that they don't come in between the pregnancy, they come with the pregnancy. So you hardly don't have any time to actually investigate
Hmm.
that patient, क्योंकि आपको जो करना है actual action करना है, because she is already having slight bleeding, she is already having so many problems. So first thing is that कि आप उसको पूछो कि तुम्हारी पिछली प्रेगनेंसी की स्टेटस क्या थी, क्या उसमें कार्डियक एक्टिविटी आई थी, या सिंपल क्वेश्चन लाइक कितने वीक्स की प्रेगनेंसी, इफ शी सेज 2.5 महीने पर खराब हो, तो 2.5 महीना मतलब कि 99% there was a cardiac activity and then it finished. लेकिन if she's already had 2-3 abortions, so she's definitely shown when she was overdue. Definitely. जैसे ही वो
Okay.
यूरिन टेस्ट कंफर्म करने के लिए डॉक्टर के पास गई होगी, because she's already had 2-3 things, two
Hmm.
three miscarriages, so she is very aware and alert कि I need to see the doctor now ASAP.
Hmm.
लेकिन उसमें
Right.
जो है अगर वो if she has no papers एंड आपको थोड़ा सा ब्राउनिश डिस्चार्ज दिख रहा है, यू गेट अ स्कैन डन, आपको उसमें सबकोरियोनल हेमरेज दिख रहा है, इट 100% पॉइंट्स टुवर्ड्स अ प्लासेंटा, एंड यू हैव टू गिव हर देन हेपरिन एस्पिरिन कॉम्बिनेशन, उसके बिना नहीं चलेगा, स्पेशली अगर दूसरी चीज है, इफ द मिसकैरेजेस हैव हैपेंड towards the end of first trimester, 13 weeks, 10 weeks, 12 weeks, 100% it is more towards a placenta. There could be a congenital anomaly, but it's going towards a placenta. So then you can, in the meantime, you can start the treatment and send the investigation. So because investigations won't come in a day. In
Right.
smaller cities, tier 2 cities, it takes at least a week for the investigation. तब तक तो things will go haywire. So for 1 week you can start, counsel the patient that we are, because we are waiting for investigations to find out the cause, we are giving a broad spectrum treatment. And if you counsel properly, she will, because most of the time, if you give her heparin injection, एक तो cost और दूसरा getting an injection daily in some rural area या घर के आसपास कहाँ लेगी?
Right.
So, so this counsel wait for a week, and most of the time it comes positive. So then you can continue the treatment, and they have very good outcomes with these pregnancies. So just spending some time with the patient, talking to her gives you a lot of clues of what must have gone wrong in the previous cases and what you can do now. If the patient has come in between pregnancies, then the field is very clear. Then you can then you have to counsel her that not to conceive accidentally till all the investigations are complete.
Right. So we can say that yes, multiple miscarriages or spontaneous miscarriages are sad, but we really need to find out the exact reason. It depends. Reason depends on that how many weeks of pregnancy you had, और अगर
Hmm.
आपके पास पूरे इन्वेस्टिगेशंस हैं या आपको हर वीक का अपना पूरा चार्ट याद है कि इतने वीक में आपकी प्रेगनेंसी fetal activity आई थी, इतने में सैग दिखा था, then it will be easy for doctor to continue with the treatment. You can say the protocol formation would be easy for the doctor.
And
Right.
secondly, if all the miscarriages are very early in very early first trimester, say 4 weeks, 5 weeks, 6 weeks, then the cause is mostly genetic.
Okay, understood. Right, right, right. So what we can do for this genetic causes, Dr. Ishita?
See, genetic causes may you have to investigate both the partners. Normally, क्या होता है? You keep investigating the female. You don't even do simple semen analysis for the male. बच्चा का जो embryo बन रहा है, that is 50% coming from mother and 50% coming from the father. So you don't investigate. You have to look at the semen report. You have to look at the smoking history. You have to look at gutta. If the spell में तो gutta and henny is very very common. So you have to look at all those lifestyle modification and what has happened. So what I tell the patient when they come, that we know that it is not salvageable, the pregnancy cannot be done about it. Already the miscarriage has happened. Then we tell them that okay, जो इसमें जो हो गया, next time please don't become pregnant till I tell you. It has to be planned pregnancy. So genetically, 90% genetic, and if the patient has come with an abortion, you can send that fetus abortus for karyotyping. You should, in fact, for karyotyping. And if the patient has again come in between pregnancies, then you can do karyotype of the mother. You can see whether there is history of diabetes or all the medical metabolic diseases. And for husband, you have to look at the semen reports. The abnormal forms in the semen report give a lot of clue of what must have gone wrong. Because the more the abnormal forms, and the chances of miscarriage is high.
Right. So we can say that investigation is important, but again, male and female, both partners need
Yes.
to cooperate with
Yes,
investigation.
infections, investigations both have to be ruled out in both the partners, and metabolic diseases. Because environment is the thing that is very important at the time of conception. So the sugar, the diabetes in the husband and wife and everybody, all the infections, all that has to be taken care of.
राइट और यूजुअली जैसे आपने मेंशन किया कि हम फीमेल फैक्टर पे ज़्यादा फोकस करते हैं वी यूजुअली टेंड टू फॉरगेट और यहाँ कहिए कि सोसाइटी ही ऐसी है कि हम इन्वेस्टिगेशन शुरू ही फीमेल से करते हैं तो मेल पैरामीटर्स कुड आल्सो बी द रीजन फॉर दिस रिकरेंट लॉसेस सो डॉक्टर इशिता, जैसे हमने देखा कि अब ये मल्टीपल मिसकैरेजेस हैं और हमें इन्वेस्टिगेट करना है ऐसा क्यों हुआ और किस टाइम पीरियड पे मिसकैरेज है, कितने वीक से इट रियली हेल्प्स। सो अगर हमें मेल पैरामीटर्स को चेक करना हो तो अदर देन नॉर्मल सीमन एनालिसिस, डू वी हैव एनी अदर टेस्ट दैट कैन जस्ट
See,
टेल अस?
usually any type of parents कराते हैं हम लोग, but that
हम्म,
does not give a very good flow. A semen analysis report, not from some center somewhere, from a standard lab, that gives lot of clues. You have to look at the abdominal forms, you have to look at the pulses, you have to give lot of thought not only on the counts, but you have to give thought on motility, you have to give thought on all these things. It has to be. You don't have to. You have to just look in between the lines when you're reading the semen report of these kind of patients. Smoking history. I'll tell you a story. A patient had come to me with three recurrent abortions. Every time she would come with the in-law, with the mother-in-law or sister-in-law or some female companion. So I told her, you get your husband. Where is he? I want to see the report. Oh, he's very busy. He cannot come. वो वहाँ का report भेज देंगे, वहाँ का भेज देंगे. I said nothing doing. I want to see him in person and I want to talk to him. So I will not write to you. I was very strict that I'll not write any medicine till I see him. So you will not believe when he came, he was 100 kgs weight. 100 kg, HbA1c 11 when I investigated him. 11.
and we are
Yeah,
just focusing on female.
yeah. She had big mota file of investigations. Everything under the sun was done.
Hmm,
And huh. And second thing is that there are a lot of factors in the female that are responsible equally for a bad oocyte quality, like the semen parameters, the lot of things they hamper the sperm quality. Similarly, PCO and
right.
endometriosis and adenomyosis. These three things actually जो है वो egg quality बहुत खराब करती है. She is ovulating, she is doing everything, everything is fine, but the fluid in the pelvis which is there, or the very small little fluid that is there in pelvis, that is embryotoxin. For that matter, and hydrosalpinx. Do an
Oh,
HSG. See, there is an hydrosalpinx. Hydrosalpinx may abortion is very, very common because the fluid in the hydrosalpinx is embryotoxic or fetotoxic. So that is another cause of abortion. Even if you give a full course of HET, but till you don't tackle that hydrosalpinx, you will not have an outcome, because it is very difficult to convince these patients to undergo a salpingectomy or just clipping of hydrosalpinx, because question ये कि अगर हम hydrosalpinx एक ट्यूब मैडम बंद कर देंगे तो बच्चा कहाँ से आएगा.
but
हाँ, because if there is bilateral hydrosalpinx, then best is clip in hydrosalpinx and go in for IVF, because without that you will not have a successful pregnancy, even if you have given a full course of ATG.
right. And I believe that time plays very important factor in during this whole procedure, because हम हर महीने किसी ना किसी वजह से चीजें डिले करते जाते हैं. And I have
Exactly.
seen. हाँ जी, please.
Yeah, no, I just agreed with you. The time plays a very, very important role, because these days everyone is marrying late. जो लोग सेटल्ड है वो शादी नहीं करना चाहते, जो अनसेटल्ड है वो भी शादी नहीं करना चाहते for some reason. And you know, lot of things, हम लोग जो पुराना प्रोसेस होता था कि गर्ल्स मैरी यंग एट द राइट एज, वो कॉन्सेप्ट आई थिंक कुछ हद तक आई डोंट अग्री विद मैरिंग एट 20 years or 18 years, not that, but at least 25, 26 is quite a good age to get married. You're almost on the path of your career, and because lot of things are covered up by a young age patient. Same problems when you're tackling at the age of 35 take a whole new dimension and whole new meaning.
Right.
I had a friend's wife, and दोनों में age gap was around 10 years of marriage. One of the husband was 10 years elder to the wife, and she used to have severe dysmenorrhea. She used to be like a fish in the water when she would have her periods. So when we came, and she was, by the time when she got married and she came to us, she was only 20 years of age. Just finished her BA college and came to us, not conceiving. So when we saw, she was almost 8 week size uterus. And we told her, since the so less time has passed, you plan a pregnancy first. So with progesterone support, we made her plan a first baby. She had a vaginal delivery, breastfed for 1 year. As soon as she was about to wean off the baby totally, I told her that you should plan your second child quickly, as
Hmm.
quickly as possible. Don't delay this. So she was, the husband was very skeptical. She was also very skeptical. इतनी जल्दी एक बच्चा हो गया मैडम, अब इतनी जल्दी आप मत करिए प्लीज, don't do this. So I told her, no, you will thank me one day. So after their life, and then she luckily conceived a second child very quickly, because this endometriosis and adenomyosis, they are suppressed by the pregnancy and the breastfeeding. Huh. So she conceived again. She had both the babies, and by the time that time, that was the days when LNG IOD was not freely available, and it was costing close to 10,000 rupees. And
Oh,
it was not even available in tier two cities. You have to get them from Bombay, request that MR to give it to you. So by the time that had come, and as soon as she delivered, I told her, when your symptoms return, just come back to me. Now she is on fourth Mirana in her
oh,
life,
okay.
fourth Mirana. And I have not removed her uterus. She is 42 years old now, and she is absolutely doing fine. Regarding the uterus part, she has other problems. That's a different story. And now with both the children is now the son has come back and is taking care of the business. So
Right,
that's the age factor. Because
right.
यही 32 years में तो she would have gone in for IVF,
बिल्कुल
because
right.
things would have gone back to work. Hmm.
एंड इवन अगर आप आईवीएफ भी प्लान कर रहे हैं देन आल्सो डोंट डिले थिंग्स इट्स लाइक कि आईवीएफ ही करवाना है हो जाएगा क्यों इतना जल्दी करना
Yeah,
बट
that's the biggest myth, you know. That's the biggest myth. You to just put in their head, बोले वो तो कभी भी हो जाएगा, ऐसे कभी भी कुछ नहीं बचेगा करने के लिए. That is
राइट
the biggest last resort. तो वो है, हमने कहा ये last कई cases में वो last resort नहीं होता. It is the first resort. So because most of the time your eggs are your late age, and it's bad. Abhi, we stimulated patients twice. Ekdam, there was no oocyte was formed. And it is such a sorry state of affairs, because 42 years age, what do you do? Because the oocyte quality is bad. There's adenomyosis, there's everything has come into play. So, and insistence ki I want my own egg. So that happens.
Right. Dr. Ishita, here we'll take one query. The lady conceived naturally also, but the issue is again with the recurrent miscarriages. So she's saying that heartbeat 3 बार आई, 2 बार नॉर्मल प्रेगनेंसी में और 1 बार आईवीएफ में. बाकी 2 एक्टोपिक थी और एक अभी जनवरी 2022 में ही डोनर आईवीएफ के थ्रू हुई. प्रेगनेंसी में सिर्फ जेस्टेशनल सैक बना. सो व्हाट कुड बी द रीजन फॉर दिस होल थिंग?
IVF जो है ना, again I have to tell you that IVF at what age it was done. Donor eggs में okay, you mask the factor. That means अगर gestational sac सिर्फ बना है, that means that there is something wrong. The genetic factor has come into play. The genetic
Right.
factor has come into play. So in these cases, you have to investigate yourself, rule out the uterine cause, do a hysteroscopy, do a HSG, rule out infections like tuberculosis and chlamydia. Tuberculosis is one of the biggest killers in this day and age. Biggest, you know, it just destroys your fertility like anything. And
Agree.
till date, there's no confirmation test for tuberculosis. ये आपको है ही. It's just your clinical, and if just the whole thing cumulative, that gives you a clue that maybe there is tuberculosis. So
Right. So
that
again, investigation plays important role.
very, very, very. You before doing anything, don't jump to IVF. Investigate for pregnancy failures, then go for IVF.
Then go.
Again, the male factor also here. Maybe why IVF? Why IVF? Maybe there was a male factor.
Right. Right.
Hmm.
We'll take another one. What fertility treatments are suitable in case of miscarriages? What could be done? I
See, first of all, as I said, पहले तो investigate होना चाहिए very thoroughly that what is the cause. The investigation itself will cost quite a big package, believe me. But एक बार cost चल जाता है, then there is lifestyle modification in the couple, especially both the couples. Smoking, gutka, everything has to stop. No if and but. That has to come. If there is endometriosis, it needs to be suppressed by giving medication, right injection. That then you can even download it. Agar apla positive hai, give her aspirin, give her that multivitamin kind of combinations that are there, PCO or non-PCO. Give her antioxidants. Usse environment you create a good environment. Then when everything is all right, then after 3 months, then you ask her to conceive on a progesterone. So progesterone
oh,
has to be given cyclically in these kind of patients. So if it is a planned thing, then I make sure that it is progesterone supported pregnancy from a pre-pregnancy state.
agreed,
Hmm.
agreed. So I think
Mhm.
investigation really plays important role whether
Very,
you
very
are
important.
going for natural
I think there
conception.
is no shortcuts to a good history, a good clinical examination till date. Most of the time, I'm coming across a lot of doctors. Sorry to say, but most of them they don't believe in PV. They don't do PV. They don't do speculum examination. Small
Hmm,
little things. हाँ, for all you know, आपने pregnancy कर ली, second trimester में पहुंची, there are huge cervical tears on both the sides, reaching up to internal loss. So at least basics never go out of fashion.
बिल्कुल, बिल्कुल। हम ये कह सकते हैं कि ये बहुत इम्पोर्टेंट पार्ट है, बट अगेन सिलेक्टिंग अ डॉक्टर आल्सो प्लेज़ अ वेरी इम्पोर्टेंट रोल हियर।
Like, see, actually, the doctor's luck and your luck has to match to give a successful outcome.
बिल्कुल, बिल्कुल, बिल्कुल। And so,
Hmm.
we always advise or we can say that we always suggest our members if you are in Varanasi or around Varanasi and you really seek treatment advisories, you want to start your IVF cycles or natural conception also, then please don't hesitate to visit Dr. Ishita. And if you want us to connect you with her, then please send us a simple email or a message. Our official number is there on our website and everywhere. Just message us and we'll arrange you everything. Uh, at times, Dr. Rishita, one last query, then we'll hurriedly wind up the session. Uh, लोगों का मानना है कि अगर periods का फ्लो कम हो गया है, then also it could be the reason for miscarriage. Is it really so?
Yes, at
अगर
times it
periods
is slow. Maybe you are starting of subclinical hypothyroidism.
okay,
Subclinical hypothyroidism. Maybe there is a tuberculosis. Maybe if there is a previous DNC, there are some adhesions. Partial adhesion, not complete occlusion, but some grade 1 Asherman has developed something. So
okay,
again, that could be the cause. Maybe you are PCO. Maybe there is a starting of endometriosis or adenomyosis. पहले महीना ठीक आता था, पेन होता था, लेकिन धीरे धीरे पेन बढ़ता जा रहा, महीना कम होता जा
right.
रहा. हाँ.
So we can say that first indicator जो आपको ये बताता है कि आपके रिप्रोडक्टिव सिस्टम के साथ सच में कुछ प्रॉब्लम है, आपके पीरियड फ्लो है,
Hmm.
वी कैन से दैट।
The period nature of your periods, not only flow,
ओके,
pain,
हाँ, हाँ,
duration, everything gives you a clue. It has to be a very detailed history taking from the patient. Not period आता है, हाँ आता है, ठीक है, कितने दिन में, वो सब कुछ नहीं. It has to be what is the change she has been noticing for in the last
हाँ,
2-3 years from the last abortion that has happened. What is the change she has noticed? और कितने
राइट,
साल से change? And when did she have a normal flow? What was her cycle length? So all that thing has to be taken into account.
राइट। सो अगर आप किसी डॉक्टर के पास विजिट करते हैं और डॉक्टर आपसे इतने सवाल पूछते हैं तो घबराइए नहीं, क्योंकि इन सवालों के जवाब डॉक्टर की इन्वेस्टिगेशन में हेल्प करेंगे और
See,
आपको
Nidhi is never shy of answering questions because she's always answering all her life to everybody under the sun. It's actually the husband that is little shy of a very inquisitive doctors because lot of skeletons will come out of the box. So I always
आई टू
uh,
एग्री।
so I always maybe he's a secret smoker. There I know a lot of people who are secret smokers. The wife doesn't know. I don't know how she doesn't know, but she doesn't know.
So we can say that few important takeaways from this session is investigation पूरी करवाइए, investigation को ढीला मत छोड़िए, because investigations आपके टेस्ट सब कुछ ही ऐसे हैं जो आपको आगे लेकर जाएंगे। एंड इवन इफ यू थिंक कि बहुत खर्चा है इन टेस्ट में, तो बिलीव मी आपका आगे का खर्चा इन्हीं टेस्ट की वजह से बच जाएगा। एंड प्रॉपर इन्वेस्टिगेशन देन डायग्नोसिस एंड अगेन उसके बाद मेडिकेशन इज रियली इम्पोर्टेंट। प्लान योर प्रेगनेंसी इन अ प्लान्ड वे, क्योंकि अगर आप प्लानिंग नहीं करेंगे तो आगे सक्सेस कैसे मिलेगा। इट्स नॉट ऑलवेज कि आईवीएफ तो हो जाएगा, कभी भी करवा लेंगे। टाइम रियली प्लेज एन इम्पोर्टेंट रोल वेदर यू आर प्लानिंग नेचुरल कंसेप्शन और आईयूआई और आईवीएफ। जस्ट टेक अ नोट ऑफ दिस, टाइम इज रियली इम्पोर्टेंट। And Dr. Ishita, thank you so much for joining. It's like we really want to continue with the session, but time crunches are there. But again, as I just
Hopefully the net service will be better.
बिल्कुल, बिल्कुल। मैंने शुरू में कहा था हमें बहुत अच्छा लगेगा आप हमारे सेशन में दोबारा आएँगे, क्योंकि आपका इतना एक्सपीरियंस है, आपका इतने अच्छे चीज़ों में एक्सपर्टाइज़ है। वी रियली वांट कि आपके एक्सपीरियंस से, आपकी नॉलेज से हमारे व्यूअर्स को हेल्प मिले। So thank you, Dr. Ishita. Thank you so much for joining, and thank you, UNS, for arranging this session. Thank you, ma'am.
My pleasure.